Is that what we done Monday, Tuesday? Is that what we did the past 3 days?
Yeah, well, yeah, Tuesday we started the lecture. I'm gonna finish the lecture today. Up to be caught up to chapter 5.
Okay. I think
Not too far.
are you able to see if I turned that in? I think I did.
Yeah,
but-
you did.
Okay.
Yeah, I haven't read it yet.
Okay.
Did that.
Thank you.
Mhm.
So this is on Friday now?
Yeah, I moved it. I'm sorry.
I will not be here.
Okay, we'll, do it next week.
All right.
And this is over medications for the nervous system. Everything is pretty much in your Canvas. So if you got any questions in your homework, it says do pages 244 to 249, and also do the lab 17.4 and 17.5. I will go over the labs with you here later. Here in just a moment. There's the PowerPoint. So again, everything's in your Canvas. So if you miss any days or anything, first lecture is on there as well. And there is the YouTube video that I will finish out with here. So we went over the complex system of the nervous system. It is a complex system for controlling and coordinating movements and functions of the body. It's dealing with nerves that perform internal involuntary functions. Better understood when broken down into divisions. The nervous system functions, there's 4 main functions. Impulses are sent to the central nervous system, the CNS. Main thing you understand what the CNS does, what the PNS does, which is the peripheral nervous system. Central nervous system is mostly affected with your ADHD meds, your ADD meds. So that's what that's pertaining to. Coordination of activities of all parts of nervous system, and sensory function that detects the change in the body. So that's all dealing with the CNS. The nervous system structure keeps the body in balance mode, homeostasis, which is a normal state. CNS is dealing with the brain and the spinal cord. The PNS, which is the peripheral nervous system, is dealing with your peripheral nerves, your 4 distinct functions, which is dealing mainly with your, your extremities. The two efferent highways for motor impulses from the CNS muscles, and then you have afferent, the carrier impulses from the soft tissue areas, involuntary muscles of the body, and other organs back to the CNS. And the neuron is the smallest functional part of the CNS. It's the cell of the CNS. The neuron, billions of neurons make up the nervous system. Billions of nerves run through the body, carrying messages back and forth from the CNS. Four main sections is the cell body, the dendrites, axon, the nerve terminal. You'll learn all that in anatomy and physiology there, if you have not taken it. There's different types of nerve transmissions. Three main states of a neuron is polarized, depolarized, and repolarized. And these are all dealing with when we're taking depression meds, antidepressants, stuff like that. Central nervous system brain structure. The brain is composed of the two types of matter. You have gray matter, which is the neuron cell bodies, and just dealing with the neuron cell bodies and dendrites. And you also have white matter, which is the bundles of the nerve fibers or the myelinated axons. Brain has several sections with specific functions. You got the cerebrum, which is the largest area, contains the ability to reason, remember, speak, language, create. So if you have a stroke in this area, you probably will lose any of those functions. There are two hemispheres. You have the right controls the logical thinking. So if you have a stroke and it's affecting your right side, your logical thinking is going to be affected, and the left controls your creativity. Central nervous system brain structure. Functions cover 6 senses. So it's dealing with the 6 senses are your hearing, vision, balance, taste, touch, and smell, and also motor functions to the muscles. Cerebellum, it's at the base of the brain and controls most of the muscle functions. Precise movements of the body, including balance, posture, and overall coordination. So if there's a stroke and it's affecting your cerebellum, your balance is going to be affected, posture, and coordination. The brainstem connects to the brain to the spinal cord, and 3 main areas are midbrain, the pons, and medulla oblongata. And again, you'll learn all that if you have not taken anatomy and physiology. Blood-brain barriers, they protect the brain and the spinal cord, allows only certain types of small molecules to enter the brain. So we're dealing with medications. There's carbidopa, levodopa, and again, these are affecting the dopamine receptors, dopamine enzymes in the brain, which gives you that happy feeling, gives you the control of your body and stuff like that. So if you're taking medications for dementia, for Parkinson's, stuff like that, this is dealing with the blood-brain barrier stuff. It allows only certain types of small molecules to enter the brain, prevents molecules from entering and possibly damaging the brain via chemical reaction. Drugs are either water or fat soluble. More fat soluble drugs can cross the blood-brain barrier. Other structures of the brain are the hypothalamus and the thalamus. It's between the midbrain and the cerebrum. They produce chemical reactions linking nervous system to the endocrine system. The hypothalamus is a built-in thermostat, so it's controlling your temperature, and it also deals with your hunger, your appetite center. So the thalamus is in charge of the most sensory stimuli, interprets and relays messages sent via nervous system, and initiates motor impulses from the cortex. Moving on down to the spinal cord. The spinal cord is divided into sections, each identified by attachment location along spinal cord. There are five main areas. You have your cervical, which is your neck area, thoracic, which is around your chest area, lumbar, lower back, sacral, below the lower back, and the coccygeal areas. It's composed of inner gray matter that houses many nerve cells. Its outside is white matter, which is dealing with your nerve fibers. You have meninges within your spinal cord. It's a thin covering lining and inside of the bones. Covers and protects the brain and spinal cord from bony structure of skull and spinal column. CSF cushions the brain and the spinal cord, and it is watery liquid. And the meninges and the CSF protect and cushion the CNS, central nervous system. Some cranial nerves originate in the brain matter. Their specific functions is labeled by the Roman numerals and the name. And most nerves have sensory and motor fibers. Moving on to the peripheral nervous system, autonomic system. It's subdivided. It controls the automatic functions. Involuntary has two branches, your sympathetic nervous system and parasympathetic nervous system. Both regulate organs, tissues, and blood vessels, and both made of nerves and ganglia. Sympathetic nervous system, nerves emerge at the thoracic and lumbar regions of the spinal cord. Function is to respond to stressful situations, your flight or fight response. Preganglionic nerves in gray matter of spinal cord are responsible for the fight or flight behavior. Send impulses to various organs and tissues for emotions like anxiety, hate, stress, anger. There are two main neurotransmitters. You have your norepinephrine and your epinephrine. Again, your epinephrine is what gets your blood pumping real fast, creates the excitement. A lot of people are injected with epinephrine if you're having a heart attack. If you remember the scene in Pulp Fiction, if you've seen it, where they stab the girl in the chest, they used epinephrine to bring her back with that. So that was pretty interesting scene there. There's 4 types of receptors. You got your alpha-1 receptors, which is located in the peripheral blood vessels, the heart, and the eyes. So you have medications that are dealing with or mess with the alpha-1 receptors. Same way with alpha-2 receptors. They are located in the smooth muscles. You have medications that affect beta-1 receptors, which is located in the heart muscles, and also medications that affect beta-2 receptors, located in the respiratory system and elsewhere. Parasympathetic nervous system. This is the opposite or counterbalance of the sympathetic system. Nerves emerge from brainstem and sacral part of the spinal cord. Preganglionic nerves are located in the gray matter of brainstem and spinal cord. Activation of a digestive system. Slows the heart rate down. Works during rest. And is inhibited when sympathetic activates under the stress. Cholinergic agents and cholinergic blockers. So we're starting to deal with depression, also with dementia, Parkinson's disease. So these are certain types of transmitters that are affected when you start to become, if you are diagnosed with Parkinson's or dementia or whatnot. The main neurotransmitter of the parasympathetic is acetylcholine. It is important for the CNS and PNS. It works quickly with a short duration of action. Two types of cholinergic agents mimic acetylcholine are called parasympathomimetics. That's a long word. They stop the destruction of acetylcholine by acetylcholinesterase. So you have a drug class that that is called acetylcholinesterase. Acetyl or anticholinergics, that's another drug class, block acetylcholine receptors, and the side effects include dry mouth and inhibition of urine output. Somatic nervous system is a network of nerves that relay messages to the CNS from the outside world and return messages back to the body. It's part of the peripheral nervous system. Regulates motor nerves that control voluntary actions of the skeletal muscles and impulses from sensory receptors. All right, we touched a little on the different conditions of the nervous system or ailments. Many disorders involve excessive muscle contractions, wasting away of muscle. The causes, some have no cause, some are by hereditary and random genetic mutations. Some investigations are also environmental as well. The first element is myasthenia gravis. It's a rare autoimmune disorder. We touched on this when we were studying pathophys. It's electrical impulses from the CNS to the muscle throughout the body, especially the throat and the eyes are affected. So it have you your heart, it's getting hard to swallow, or it's hard to control your eye movement. The causes are sometimes a tumor of the thymus. Common side effect is the drooping eyelids. Muscles tire easily and take longer to recover. Chronic disease worsens over time. Respiratory system is affected and death results. The drug treatment is anticholinesterases, which is a drug classification there. Surgery to remove the thymus if tumor is present, and no cure for myasthenia gravis except where cause of the tumor. Drug treatment for myasthenia gravis, class of the drugs is cholinergics. Drug action is to block the destruction of the neurotransmitter acetylcholine. So again, we're trying to block any kind of destruction of the acetylcholine neurotransmitter in the brain by the enzyme acetylcholinesterase. Side effects occur because of overstimulation, such as nausea, vomiting, diarrhea, severe abdominal pain. Then you have polyneuropathy, which is pain in the nerves, I believe, characterized by distal loss of sensation, burning, and weakness. Diabetic neuropathy is a common side effect of certain medications. Some treatments for polyneuropathy, which is difficult to treat. Some drugs used are antidepressants, narcotic pain medications, and anesthetic medications. Cymbalta inhibits reuptake of serotonin and norepinephrine. So there's some more neurotransmitters there, your serotonin and norepinephrine. So it's inhibiting those. Some non-drug treatments are transcutaneous electrical nerve stimulations, or TENS, which is you know, they apply those little stickers on your back, and they help relieve you from any kind of tension through electrical impulses. Then you have daily foot inspections to prevent ulcers. And this is all mainly, you know, if you have diabetes, type 2 diabetes, whatnot. Another element of the nervous system is epilepsy. It's a seizure disorder, hyperexcitability of the nerve cells in the brain. Diagnosis is based on the electroencephalogram, or EEG. Two types of seizures are partial and generalized. Different levels of intensity from the petit mal, which is the least violent, and then you got your grand mal, which is longer and more intense. Other causes are skull fractures, just in case they fall down, and there's also tumors. There's people that have died due to epilepsy. Treatments are drugs to surgery, which are operable tumors. Drug types are anticonvulsants, so that is your drug classification. Anticonvulsants inhibit impulses with CNS by inhibiting one or more of the ions. So put together your epilepsy drug class anticonvulsants, okay? CNS by inhibiting one or more of the ions, which is your sodium, your calcium, and your potassium. The correct doses stop seizures, and drugs are various agents. Your hydantoins, which is like your phenytoin, barbiturates, succinamides, and benzodiazepines. Those are some drugs that help out with epilepsy, or drug classes. Moving on to Alzheimer's disease. It's a degenerative brain condition. It progresses as one ages, but can occur in younger people. The early stage, there's early stage, mid stage, and late stage categories. There is a loss of neuronal synapses, information from memory banks. A person cannot process information, and memory loss occurs. So this is why sometimes music helps out, you know, with remembering certain types of things in your past, certain types of people. Also, even eating certain types of foods, which bring out certain tastes, helps these Alzheimer's patients as well remember certain things of the past. Let's see. Person cannot process information, and memory loss occurs. Brain cells are replaced by deposits of protein, and they create tangles and knots in the brain. The brain shrinks in size, and the memory is affected. Dementia and abnormal loss of memory and basic mental functions occurs. Other symptoms include inability to perform normally familiar tasks, difficulty talking, disorientation, and familiar surroundings. Drug treatment for Alzheimer's disease. Treatments include medications and skilled nursing facilities. Main therapy, again, here you go with cholinesterase inhibitors. That is a drug class. Some medication types of cholinesterase inhibitors are donazepam, antacrine, and memantine. Other agents are nimodipine, physostigmine, and they may delay the progressive disease. Moving on to Parkinson's disease, which is a loss or deficiency of the dopamine, which is another neurotransmitter that we talked about. Basal ganglia, group of cells or gray matter located in the medulla, white matter of the cerebrum. Function is to regulate muscle tone and body movement. So whenever a person has Parkinson's disease, they're more likely to be shaking all the time. Cannot stop that shaking. Dopamine, which is a natural chemical in the brain that inhibits movement. And acetylcholine activates neurons and dopamine inactivates them. So those are two of the neurotransmitters that are affecting a person with Parkinson's disease. Lack of dopamine creates a movement without ending. So if you have low dopamine in your brain, then you're going to be shaking a lot. Severity of symptoms increases over the years. Most common symptoms are tremors, muscle rigidity, loss of balance, hypokinesia, and bradykinesia. Diagnosis is difficult because of the slow progression. Treatment includes surgery, physical therapy, and drugs. Drugs increase dopamine and acetylcholine levels in the brain, and drugs have major side effects. Moving on to multiple sclerosis. Multiple sclerosis is a deterioration of the myelin sheath. The myelin sheath insulates surrounding neurons. Sheath is replaced by sclerotic hard tissue. Average age of onset is early 30s. Symptoms include muscle weakness, abnormal sensations, numbness, tingling, vision change, loss of coordination. Patients experience periods of remission followed by attacks of loss of function, and they cause an autoimmune disease. Drug treatments for multiple sclerosis. The first line of treatment is a disease-modifying immunotherapy to slow and minimize progression of the disease. A second line of treatment is steroids given to treat flare-ups that can last from 1 to 3 months. Migraine headaches, they range of triggers, hormonal changes, food, stress, bright lights, and other changes in the environment. Serotonin levels drop. So whenever you have a migraine, your serotonin levels are dropping. This releases neuropeptides that travel to the meninges, where they cause blood vessels to become dilated and inflamed. There's no known cure, and preventive measures are exercise and avoiding these certain triggers. First line of treatment are non-steroidal anti-inflammatory drugs, your NSAIDs or aspirin. Excedrin seems to work pretty good for a lot of individuals. For severe migraines, the suffix of the medications will end in triptans. So you got sumatriptan. Also, pain relievers help to treat migraines, and other preventive medications are beta blockers, calcium channel blockers, and antidepressants. These are heart meds, actually. All right. Let me move on to with this lady here. Let's finish up what she was talking about. Let's see.
So with beta-seron, subcutaneous injection, the medication Copaxone.
So she's talking about
the medication
multiple sclerosis
dalfampridine is
medications.
oral. Migraine headaches are episodic. Severe headaches frequently cause nausea and or light and sound sensitivity. Migraine triggers vary from one person to the next. They can be from hormonal changes, food, stress, bright lights, or other environmental changes. Most cases, there is no identical cause. Drugs can influence migraine frequency and severity. serotonin agonists frequently treat migraines. Migraines are common and affect about 12% of the population. There's no cure for migraines right now, and you can look at some non-drug treatment and drug treatments. The medication Imitrex. It
And again, that's a sumatriptan generic name there.
is available as an oral, a nasal spray, and a subcutaneous injection.
Then you have elatriptan. So keep in mind the suffix for migraine headaches is triptan.
Medication Relpax. It's only available as an oral. A stroke is an arterial blockage or hemorrhage blocking blood to the brain. Strokes have several causes, but most cases are ischemic strokes. The decrease of blood flow to the brain happens when a clot blocks the blood vessel or the vessel becomes too narrow. This blockage or restriction deprives the brain of oxygen and the brain cells can die. Although the disruption is specific to the vascular system, it also affects the nervous system and its functions. Damage severity depends on the blockage size and how much it harms the brain tissue. Effects range from limb weakness to being paralyzed on one side of the body to the loss or the ability to speak. The most common symptoms of stroke include severe headache, dizziness, visual difficulties, loss of balance, difficulty moving one side of the body, weakness in facial muscles, and that causes difficulty speaking. Depression. The World Health Organization lists major depression among the most burdensome diseases in the world. In the United States, the lifetime prevalence of major depression is approximately 16%.
This area right here is going to be increasing in the future. We're going to be dealing with a lot of, mental health has been really increasing, getting even worse. So there's going to be a lot of job openings in regards to dealing with mental health issues.
That number has went up since this book was published with the pandemic and inflation and the way our world is. I'm sure that's going to continue to go up. Depression types range in severity from minor to major depression with thoughts of suicide. There can be postpartum depression after pregnancy, seasonal affective disorder, depression during the winter months. Major depression can be difficult to treat. It hinders a person's ability to function normally, and it hinders activities such as sleeping, eating, working, studying, and forms of enjoyment. Many times depression coincides with a severe illness or anxiety disorder. Depression medications increase brain levels of neurotransmitters, and under normal circumstances, neurotransmitters stimulate the brain as they are released, and then they are reabsorbed by the brain cells. Because people with depression may lack adequate levels of neurotransmitters, antidepressants work to increase the neurotransmitters available to the brain. Table 17.9 lists select medications that are available for the treatment of depression and their class. We have SSRIs. They increase the amount of serotonin available in the CNS.
And SSRIs pretty much in with PRAM. There are exceptions. You got fluoxetine, paroxetine, and sertraline there. So keep those in mind.
SNRIs, serotonin norepinephrine reuptake inhibitors, commonly abbreviated as SNRIs, increase the amount of serotonin and norepinephrine available in the.
And I don't think there's any specific suffix on this one. Just kind of have to remember these. I believe duloxetine, you just have to remember that's an SNRI.
Tricyclic antidepressants, TCAs, primarily increase availability of norepinephrine and serotonin in the CNS.
So you have amitriptyline and nortriptyline, so they kind of in the same way for TCIs. Also, an exception is doxepin.
MAOI
Keep in mind what she's about to talk about, these monoamine oxidase inhibitors, MAOIs. Um, they counteract with a lot of medications and some foods. So there's certain medications you cannot take with the MAOIs, or some foods you cannot eat with the MAOIs because the enzymes they counteract with each other.
Monoamine oxidase inhibitors. Inhibition of the MAO enzyme leads to increased availability of neurotransmitters such as norepinephrine and dopamine. Bupropion increases the availability of dopamine in the CNS.
So like bupropion, which is brand name is Wellbutrin. These all really were at first smoke cessation, but they found out that it helps with some nervous system ailments as well.
This medication also works for smoking cessation. Trazodone increases the availability of serotonin in the CNS. Vilazodone increases the availability of serotonin in the CNS and is a 5-hydroxine tritamine receptor partial agonist. In here, just list some examples of those medications that we've previously talked about. Anxiety disorders. So unease and fear characterize anxiety, and these are normal.
What drug class deals with anxiety disorders? Yeah, drug class. It's lorazepam, diazepam, alprazolam. What drug class is that? That's a controlled schedule. It's a schedule. Benzodiazepines. Benzodiazepines is the drug class over all those, which deal with anxiety disorders, and they are all mostly schedule class 4s.
Logical reactions. It becomes problematic when it interferes with daily personal and social interaction.
This is why they gave you diazepam before dental procedures, just in case they're going to do a root canal or take out some wisdom teeth. They'll give you some diazepam to just calm you down.
It may elicit panic attacks or compulsive behaviors. Anxiety can be expressed as a feeling of fear or dread, with symptoms ranging from a rapid heartbeat to trembling. We divide anxiety disorders into several different types. These range from panic disorders, such as post-traumatic stress disorder, and phobias, to personality disorders, such as obsessive-compulsive disorder. Some anxiety disorder types include the following: generalized anxiety disorder. Here, a person experiences constant anxiety and worries continuously about common life problems over a period of 6 months or longer. Social anxiety disorder, also referred to as social phobia. A person experiences constant anxiety and extreme fear around others. They attempt to avoid public situations and people. This avoidance stems from overwhelming fears of being humiliated, being judged, or feeling uncomfortable. This condition disrupts the person's normal daily activities. Panic disorder and anxiety disorder that includes panic attacks. Situation events can trigger these attacks. During a panic attack, the person experiences severe apprehension, fear, and terror. In addition to physical complaints such as dizziness, heart palpitations, or shakiness, severe panic disorders can lead to phobias and PTSD. PTSD is a condition that follows traumatic or terrifying incidents. Sight, sounds, and even smells can prompt flashbacks, nightmares, and constant memories. Soldiers returning from war are a common group suffering from PTSD. Other people who may suffer from PTSD include rape victims, those exposed to violence, those diagnosed with a life-threatening medical illness, and these can occur anytime after the precipitating event. Phobias are marked by irrational, persistent fear of situations, people, or things. The person suffering from a phobia experiences several symptoms, including a rapid heartbeat, shortness of breath, and trembling. Treatment ranges from psychotherapy to anti-anxiety medications.
So like social media has a little part to do with all these anxieties going on and whatnot, because you have immediate news coming on 24 hours a day, whether it's good or bad, mostly bad. But I mean, this is why people are, this is why I tell you that, these certain areas in the job of, mental health illness is increasing because people are just, they become anxious because of certain news that they watch on a daily basis, or what they see on a daily basis or whatnot.
So now we will list the medications for anxiety disorders, much of which are controlled substances. They are easily abusable. You can see it in auxiliary label for most of these medications is avoid alcohol. You should never take alcohol with an anxiety medication.
Because they impair you for the most part, but they can suppress you from breathing. And a lot of these are very addicting, and you have to wean yourself off of these certain medications of anxiety, as well as depression, antidepressants as well.
Can cause respiratory depression. All benzodiazepine medications are Schedule 4 medications. The only one, as I talked about earlier, is buspirone. That is not a controlled substance. Patients with bipolar disorder may experience excessive mood swings that range from manic, which is high, to depressive low state. Specific symptoms of mania include agitation, hyperactivity, inflated self-esteem, risky or reckless behavior, and decreased sleep.
Has anybody set foot in like a mental institute or anything like that? It's very interesting. Very interesting. Where I used to work in Big Spring, we had a floor on the top floor that held all the mental institute people, and I mean, there's just very interesting interactions with them. I mean, is that the hospital? Well, they have the mental facility over there, which is the state hospital also. But at Scenic Mountain, that was where I was working at the time. We would have to fill medications up there from time to time, a lot of the antidepressants and anti-anxiety. And there's people shriveled up and to the corner, and they're just to themselves, and they're hiding themselves. A lot of the times, but there's some that just that are very disruptive. They have to be on lockdown, where they have to get injected with certain anti-anxiety just to keep them from, being disruptive to anybody or hurting anybody else. It's very, very interesting.
And here are just some examples. We have lithium, Vraylar.
Lithium used to be in 7-Up.
And all patients taking lithium must have their blood levels monitored regularly for toxicity. It can take several weeks to see the desired effect of this agent. Lithium is kind of an older medication used for this. More than likely, it's not being prescribed to like newer, younger patients, just because of all of its side effects. Schizophrenia is a psychiatric disorder involving chronic or episodic psychosis. It can cause impaired social and occupational functioning. Schizophrenics commonly exhibit both positive and negative symptoms. Positive symptoms can include hallucinations, delusions, and disorganized speech. Negative symptoms can include depressed mood and impairments in attention, memory, and high-level functioning. The schizophrenia diagnosis comes from the presence of symptoms in addition to diminished social function and or occupational dysfunction for at least 6 months. Although the exact cause is unknown, it has a strong genetic component. Some risk factors are living in an urban area, immigration, birth complications, a birth date in late winter to early spring, a reflection of influenza virus exposure during neural development, and they have higher rates of other psychiatric disorders such as depression, anxiety, substance abuse relative to non-schizophrenics. I have highlighted in drug treatment a particular devastating adverse reaction that can occur while taking antipsychotics is tardive dyskinesia. I'm sure you've seen commercials about this. These symptoms can include involuntary movement of the face, muscles, tongue, jaw, and head.
And now they've developed a medication to treat that now.
If these symptoms appear, the medication must be stopped immediately as these effects can be irreversible. It almost causes like a tic, like almost like a tic that a person would do. I can't think of what the thing is called right now. My brain's overloaded, but yes, you know what I mean. We have medications that treat schizophrenia. Haloperidol, we already kind of talked about that. One of the side effects is tardive dyskinesia. And it is available as an oral solution, as an oral tablet solution for injection and suspension for injection, which is that long acting. This medication is great for long acting because if a person has acute psychosis or schizophrenia, sometimes they can be nervous or be paranoid. So it's hard for them to hard for people to get them to take pills. We have the medication Clozaril,
Which we discussed when we were, there were certain types of programs people were on. This is another one that you have to keep closely regulated. Clozapine or Clozaril is one of those programs that we discussed, like the iPledge program, whatnot. This is another one that you would that would be on a program.
which has a risk of hematological effects, including a granulocytosis. It is available only through a monitoring and distributing system to ensure that patients have received appropriate blood monitoring.
And they kind of end with PINE, clozapine, olanzapine. So schizophrenia meds, clozapine, PINE.
And I remember what I was talking about before, Tourette syndrome.
Yeah.
It's almost like a tic that you get with tardive dyskinesia. Is almost kind of like a tic you get with Tourette syndrome. Like you almost don't have control of what you're doing in your face. Except for you're not obviously saying things crazy. You're just kind of making weird movements. Here is some more medication for schizophrenia. And we have different dosage forms for the medication risperidone. The medication Abilify is indicated for schizophrenia, agitation, depression, and bipolar disorder. Same with the medication Geodon. Insomnia. So patients with insomnia have impaired daytime functioning due to a difficulty falling asleep or difficulty maintaining sleep, or they experience poor quality sleep. A person is considered an insomniac when all three following factors are present. They complain of difficulty falling asleep, difficulty maintaining sleep, or waking up too early. The sleep difficulty occurs even though the person has an adequate opportunity to sleep, and the impairment in sleep causes difficulties in daytime functioning. An estimated 30 to 50% of the population has insomnia. And we have medications that are approved for the treatment of insomnia. So benzodiazepines. Benzodiazepines are also used to treat anxiety. These ones listed here usually are given for the treatment of insomnia and not anxiety. We have non-benzodiazepine hypnotics.
And these type of medications, they create, well, most of the side effects create like really vivid dreams. Some have people sleepwalking out. So those are some side effects on those.
Melatonin receptor agonist, like melatonin, which is just natural, or the medication Rosarum.
So we've kind of given kids, well, as adults, we've given kids melatonin to help them sleep.
We have dual orexin receptor antagonists like Belsomra and antihistamines.
So you get antihistamines again. Benadryl makes you drowsy, for the most part. And you also have your Unisom, which is doxylamine. So these are also help with you have trouble sleeping.
Are actually over the counter, Benadryl and Unisom. This is just kind of going more into it, listing the routes of administration. All of them are usually oral. Zolpidem is available in a few different oral dosage forms. I believe it's available in liquid and tablets and controlled release tablets. ADHD is a physiological brain disorder where a person struggles to focus his or her attention or to engage in quiet, passive type behavior or both. Boys are 3 times likely as girls to warrant an ADHD diagnosis, which affects 3 to 5% of school-age children. Signs and symptoms can be impulsive, explosive, or irritable behavior. And here are select medications in table 1711 for the treatment of ADHD.
So most of these are controlled 2 medications, except for tamoxetine. Tamoxetine's not scheduled, so just keep that in mind. You might have a question, which one of these medications is not a scheduled drug? So make sure that you do pick a tamoxetine on that. So
most of these here are controlled substances and they're C2, so the highest controlled medications. Adderall, Focalin, Focalin XR.
So again, they usually end in amphetamine, dextroamphetamine, sometimes phenidate, dexmethylphenidate, also lisdexamphetamine. So keep that in mind. ADHD meds, phenidate, amphetamine type endings.
XR, Dexedrine, Vyvanse, Concerta, Daytrana, Metadate ER, Methylene, which has been discontinued, and Ritalin. So all of these medications here are all the medication methylphenidate. Ritalin was the first one on the market, I'm pretty sure, and then they made extended release tablets so the patient didn't have to take as many pills during the day, which is nice because most of the time it's children, school age, they have to leave their classroom to go take the pill. Most of the time you can give it to them before they go to school so they don't actually have to take it at school, or they only have to leave the classroom once a day. There is a patch, so it's applied once daily in the morning and can be removed after 9 hours. There is Metadate CD, so extended release capsules, Metadate ER, and regular immediate release Ritalin. We also have the medication atomoxetine, which is not a controlled substance and usually kind of the first line of therapy for kids that may be displaying symptoms of ADHD. So we would try to give that to them first before putting them on these other stronger medications. So you can see the side effects. Trouble sleeping is a big one because a lot of these are derivatives of amphetamines. Smoking cessation is a difficult process that the pharmacy staff is usually involved in, with from recommending OTC products to providing counseling and follow-up with prescription products. Prescribers can employ the antidepressant Zyban or the medication Chantix to help patients quit. Here's just some more medication or information about the medications. Chantix is oral. And here's the common adult dosages. And we already kind of talked about Zyban before. That is a medication, bupropion, which is also used for depression.
All right. So there's quite a bit of nervous system ailments. You're dealing with Parkinson's, dealing with dementia, dealing with anti-anxiety, dealing with migraines, strokes, even dealing with smoking cessation. So make sure you kind of put all those different types of ailments with the direct drug classifications, and with that, the correct medications within those ailments. All right, test tomorrow. I'm not gonna keep on pushing that back, but if you're not gonna be here tomorrow, we'll get that done next week sometime. Y'all have a great Thursday.